Better Spaces is a health and happiness solution for today's hybrid workplace. My name is Dr. Paul Cachola with PAR5 Physical Therapy, and I've partnered with them to bring you an easy and educational workday session. So today's session is Let's Go for Snow. It's slope season prep. It's where we want to learn how to prep for ski and snowboarding season to avoid pain and injury so you can hit the slopes confidently and with a durable and resilient body. So let me get this slide deck up here. Pop that open. That's great. You guys can see that. All right. So just as a disclaimer, because I'm a physical therapist, I own a clinic in Randolph, New Jersey called PAR5 Physical Therapy. I have to give this disclaimer that this is not physical therapy advice. It's just general information that's geared to a broad population. So if you're dealing with something specific, make sure that you get a customized and individualized and thorough physical examination so you could fix the root cause of your issues. All right, so without further ado, let's get into it. So the big thing is that as we get into winter sports and the change of the weather, it's a new season, we want to avoid injuries. So common injuries, especially for snowboarders, are most likely to occur in the upper extremity, most commonly wrist or elbow fractures or sprains. And for skiers, it's the lower extremity, and it's usually in the knees with a ACL tear, probably the most common you've seen, or a meniscus tear. All right. So these are some common causes of injury or factors that can increase your risk of injury. One of the things that we want to think about and keep in mind as we're hitting the slopes is that, one, we don't want to go alone. All right, always go with a buddy so that you're safe. Wear protective equipment and make sure it fits properly. Of course, we want to wear warm clothing. We want to follow the rules of the mountain and use proper technique, and always be aware of your surroundings, especially other skiers or snowboarders that are downslope of you or coming from the sides of you. And also know your limits, your skill level, and pick the path that most corresponds to your ability. That's always a smart route. And also do some warm-up exercises. We're going to be talking about that in a moment. And also drink plenty of water. Dehydration occurs before you become thirsty, and we know that we perspire even in winter sports, so we want to replenish that water and make sure our body and muscles work well. All right, so we're going to talk about, also I just want to touch on the equipment. You know, helmets are always a good thing. I remember that I was snowboarding out in Colorado with a friend, and we didn't wear any helmets at the time, and he hit a tree. His head hit a little tree branch, and he had a little abrasion there, got a little concussion, but he was okay, thankfully. But anyway, helmets are always important. Wrist guards if you're a snowboarder, and knee braces if you need them as a skier. You always want to be cautious taking these sharp turns, especially for skis. Those, we want to work on your quad muscles, the thigh muscles, and wear knee braces when you need to. Wrist guards, again, like I said, they reduce the risk of injury, especially for snowboarders that fall and they put their hands out either in front of them or behind them to break their fall. And helmets, like I can't say enough that they're highly recommended. Oh, we've got somebody in the waiting room. Let's send that person in. Helmets are highly recommended for skiers and snowboarders. You know, one fall, one bump can be just enough to produce concussion, and we want to avoid that. All right. So components of a winter sports workout, we're going to touch on endurance, stretching, strengthening, and balance. And these are the stuff that we're going to talk about: cardio or high intensity interval training, hip stretching. And we're going to just go through these points and think about, all right, what can we do prior to going out on the mountain, and what can we do while we're at the top of the mountain? We get up the ski slope. How do we prepare for our next run if we're not completely warmed up? But now is the time. We haven't had that much snow yet here on the East Coast in New Jersey and New York. So this is the time to prepare your body for the next season of your winter sport, whatever that may be. All right. So let's talk about this cardio, or high intensity interval training. Typically what I recommend for my clients is that if you're an athlete, cardio is something that would not be like the typical 30 minutes on the elliptical or 30 minutes on the bike at a steady state. That's more aerobic training. And we want to get into maybe bouts of intense exercise or intense effort, maybe for 20 seconds with a 40-second rest, or 30 seconds of work and 30 seconds of rest, or work for a minute and rest for as much as you need to. So it's like every minute on the minute you're doing something, or the more intense type of interval training called Tabata, where you're doing something for at a high intensity for 20 seconds with only a 10-second rest, and you're doing different types of exercises. There's 3 different energy systems that your body can use, right? So we have the anaerobic alactic, or the ATP-CP system, and that's for high intensity and short durations or bursts. It doesn't require any oxygen. It uses your own body storage of creatine phosphate as an energy, and it's probably good for 10 seconds of work. Then we have the anaerobic lactic energy system, the glycolytic energy system. This is high to medium intensity for up-tempo exercise or sports. It's up to 90 seconds. You know, most sports or athletics use this system. This system does not require oxygen, but waste products such as lactic acid accumulate in the blood and the muscle cells, and that gives you that burning sensation in the muscle, shortness of breath, and fatigue. And those are all symptoms of this lactic acid buildup. Focusing on this energy system during training can reduce the amount of lactic acid that builds up and build your tolerance, and that prolongs your ability to utilize this system, which allows you to get down to the slope without being too fatigued. The last energy system is the aerobic energy system, and this is for low intensity, long duration endurance exercises. So this is an energy system that we could use up to several hours. It's very slow, and it requires oxygen. So if you think about, you know, what type of skier or snowboarder are you? Are you a type of person that likes to bomb down the mountain and carve the turns and then take a break? Or are you a cross-country skier where you're going mostly on flat or slight inclines where you're constantly moving and moving? So I usually tell people that the anaerobic lactic system, which is that, you know, 90 seconds of work, and then that energy system that you could use for up to 90 seconds, is probably the best one, and that can improve your ability to tolerate lactic acid levels in your body, and also can feed into your ability to use the aerobic system as well. So if you're pressed for time, let's think we're always pressed for time, what do we want to optimize our workout routine? I think it's more beneficial to get on some type of routine where you're doing a high intensity interval training versus a long duration on an elliptical or a bike for your cardio, because that'll hit the middle anaerobic lactic system, which is more functional for skiing or snowboarding. All right, and then let's get into some hip stretching. So we want to hit the glutes, and we could do these in different positions. All right, so I'm going to pull up my 2-shot here, and we're going to talk about some things that you can do to stretch out your hip. So we think about, like, for snowboarding and skiing, there's a lot of side-to-side motion with the skiing, but there's also a lot of rotation that happens when we're snowboarding because we're bound in the bindings. So the first thing that I have people do is, let me just tilt this down a bit so you can get that angle, is to get down on the ground. I always start on a supine position and just work on leg rotation or hip rotation. So I hope you can see me in the camera here. A wide stance, and we could progress to different positions, like and different intensities of the stretch. But this is called a windshield wiper or a hip drop. It's basically going side to side, just getting that rotation in the hips. And if we have good rotation in the hips, that will also prevent our knees from over-rotating, or that ACL meniscus structure that we mentioned earlier. Usually that happens because there's not enough rotation in either the ankles or the hips. So this is one way to start that rotation, hip drops, and usually about 30 seconds to a minute for this position. And then we can progress to being in an upright or seated or supported seated position, wide feet, and then just letting the hips drop in and out. As much as you can, we want to keep the sit bones or your butt on the floor. We don't want the hips to kind of pop up where we're letting everything go. So if you're super tight and this is difficult, and especially this position is this, if this is difficult for you, and then rotating side to side, then I would stick with either the supine one with the wide stance with the feet, or the supported seated one. All right. So this is a hip rotation stretch, and then we're going to get into like the hip flexor stretch. So the hip flexor stretch is done in this half kneeling position. I'm going to stretch out my left leg, and we're going to stretch out the front part of the hip here. And this typically tends to get tight with a lot of prolonged sitting. If this is short, this complex in the front, that inhibits our ability to access or utilize our glutes during skiing or snowboarding, and that can create issues with more stress on the knee. So in this position, we want to see if we can contract the glutes here, contract the butt muscle, and then contract the abdominals, and then slowly slide the hip forward, and that'll give us our stretch here. And we repeat that for, we hold it for 30 seconds and maybe once or twice on either side. All right. And then we could do the classic hamstring stretch. There's nothing wrong with that. And that's pretty easy. You could sit down, kind of sit and then kind of just reach forward, or you could do it in standing. This is probably one that everyone knows. 30 seconds for that stretch as well. Or we could do a standing quad stretch where we're just kind of holding, and you could hold onto a wall for this one, just getting the quad in the front. For skiers, we want to make sure that you have enough ankle dorsiflexion to kind of fit in the boots. So what I like to do is just take a little bolster or roll or towel or whatever, put it over here, and then get your foot elevated. So you can see how the front part of my foot is elevated on it. My heel's on the ground, my foot's pointed straight ahead. And I'm just going to bring my hip forward. As I bring my hip forward, that gives me a stretch into the calf. And then that'll get me the calf stretch so I can access the amount of mobility that I should be able to in my ankles. And because there's two muscles that cross the ankle, the Achilles, we want to do it with the knee straight, and also repeat the stretch with the knee partially bent. So you can kind of see how that's partially bent there as we're going into this position. 30 seconds with that. So we actually went down. So we're going to go into another hip stretching workout or warm up that you can do on the mountain. So let's just say you've gotten off the lift, you've gotten your boots. You might do this at the lodge or whatever. But the first thing that we want to do is for warming up the hip, we're just going to do a little bit of a leg swing. So you could hold onto your poles or hold onto your board or wall or something, and we're just going to start to swing the legs forward and backward. Doing this actively warms up the hip and stretches dynamically the hip flexor, quad, and hamstring, everything that we just stretched out statically, let's just say at home or at the gym. Now we're on the mountain winding this up, and we're going to do at least 30 seconds to a minute of these leg swings. And for snowboarders, we want to add rotation. So we're going to do across the body. So I'm keeping my upper body still as much as I can, and then rotating and swinging the leg across my midline. As I'm doing this, my foot is pointing up at either side. So I'm rotating through the standing leg, and I'm rotating through the swinging leg as well. So we're getting full rotation there. We can just feel like we're getting loose and warmed up. And then that'll allow us to kind of get a little bit more loose into the hips as we go into our run. All right. Oh, so and if we want to try and work on some squatting as well, you can do it with a narrow stance. If you're a skier, I always have people do this, is to see, can we squat down, maybe reaching out in front or holding onto the ski poles and access that knee bend as much as we can. And doing a couple of these, maybe 8 to 10 of these, will hopefully help to warm you up for your run. And for snowboarders, you can do the same thing. And that kind of brings us into our next segment here, which is basically the knee and hip strengthening. And this is something that we need to prep outside or before our trip, before our ski or snowboard run. This is going to be at home or at the gym. We're going to work on squats, what we call Bulgarian split squats or lunges and deadlifts, and basically get our legs stronger or strengthen our legs in a functional way. The one thing I would say is that if you are a skier or snowboarder or anything, and you are looking to strengthen your thighs, and you're at the gym, and there's a machine that you sit in, and you put the pads on, the pad goes across your leg, your thigh, and you have a pad across the ankles, and you're doing this for, I don't know, 10 reps, 3 sets of 10 or whatever. Don't do that anymore. That's not functional, because unless you're like a soccer kicker that just does this, there's no reason for you to do that. And plus, it puts a lot of stress on your knees. So that knee extension machine, I'd probably outlaw it, and then have people do squats. So squats are more functional. The key points is that we have our feet about shoulder width apart, so it's a little bit wider than hip width, and we can have a little bit of a turnout with the feet. Probably 10 to 15 degrees is sufficient. We don't want to be like 45 degrees. That, if you feel like you need to squat in this position, that probably means that you might have a tight ankle, which can cause problems with your knees as you squat. So maybe a 10 to 15 degree turnout. You want to put your hands out in front of you, so that'll help with your balance. We're going to send the hip back, and then we're going to squat down. As we squat down, the knees stay over the ankles. They don't point in like this, and then the weight stays in the midfoot. All right, so the hips go back and down, and then the knees stay put. So I see you from the side view here. So shoulder width apart, and then we're going to send the hands forward as we send the hips back. So here we're going to do at least 8 to 12 repetitions of squats. We can add a weight if you want to, but really before we add any external resistance, we want to make sure that we have good form. Now, the progression of that is the Bulgarian split squat, and that's basically doing the same thing with your leg supported on a chair or a bench. All right, so I'm going to use my little bench back here, or chair, and it's a single-legged squat, and the goal is to develop enough single leg strength that you can control this motion and have your knee touch the ground and be able to come back up. All right, so I'll show you on this side here. So again, we have a little bit of a component of balance and stability, but everything stays the same. We want to push through the midfoot. We can put the hands out in front to assist with the balance, and then we're going to lower ourselves down, touch lightly, and then come back up. So because we're using one leg to do that exercise, is going to be twice as hard as doing a regular squat. So I'd probably cut the reps in half, maybe 5 to 8 reps per side, and then those 2 exercises at least 3 to 4 sets each. All right, build gradually and take breaks as needed with this strengthening. Let's see here. So the next one is lunges. So if you're a skier, it's basically sometimes we'll get onto one leg and be able to support and make those cuts. If you can't tolerate the Bulgarian split squat, we could always do a lunge. Now we have 2 options, a forward lunge and a backward lunge. The points of performance stay the same with the squat. We want to be able to kind of plant our leg and then lunge down, have our back leg touch lightly. Or if you're having knee issues, I would probably recommend a backward lunge. So that keeps the weight on one leg. We just bring the leg back, and then we lunge down, gently touching the leg. The mistake that I often see people do is that they're afraid to stay on one leg. So they take a small step and they try and lunge like this. And this is such a narrow stance that it puts more stress on the knee. So if you're going to do a backward or forward lunge, make sure that you're stepping at least the length of your shin so that my knee and ankle wind up in this 90-degree orientation. It's like a vertical shin here and a vertical shin there, and then I come up out of there. From the front, the key points is that we want this knee to stay over the ankle. We don't want that knee to go in like that on our way down or on our way up, because that is what causes a lot of the ACL or meniscus issues. All right. Okay, so next slide, I guess what we're going to get into here is balance and proprioception, right? So balance and proprioception, a couple of things that we kind of introduce is workouts and exercises that really incorporate single-legged work, okay? So the more balance and stability you have on one leg, the less likely you will fall, and therefore the less likely that you will get injured. So the first thing that I would do is just to work on Can you stand on one leg, right? For normal adults, we want to be able to stay in this position for at least 15 seconds, all right? And that's with eyes open with just one foot in the air. The knee doesn't have to come up to hip height, or this is much more difficult, but just bending the knee, getting the foot off the ground, 15 seconds, eyes open would be a pretty good one, right? Ideally, we would like to try and go for 20 or 30 seconds with this, but I'll just say 15 seconds is okay. If we did it with eyes closed, 10 seconds would be the bare minimum, all right? So that's the static balance activity. But life is not static. We want to develop stability with movement. So I do a toe touch. And the toe touch is taking one foot off the ground and taking my opposite hand and just reaching down, touching my leg, and then standing up, and I can put my foot down on the ground. From the side view, other side view, I'm just going to lift up my leg, touch my toe, and then come back up. From the front, key points of performance here is that we don't want this knee. We can allow this knee to bend to allow me to bend and touch my toe, but I don't want that knee to bend inward, all right? So we would definitely want to avoid this position, all right? Toe touch, and then back down, come back up, all right? If that is difficult, then you could scale it a little bit by using a pole, a stick, a table, whatever, and then just hold on with one hand while you touch with the other, all right? But it's important to go slow with this and try and really force your hip, ankle, and knee to learn how to move and how to balance and hold yourself up, okay? So single leg stance, and there's one more, it's called a skater squat. It's sort of like a variation of that Bulgarian split squat, so where we have a very narrow stance with our foot, and my back leg, my right leg is basically like a toe touch, and I'm going to try and squat as low as I can, like I'm skating. So I've got this back leg helping a little bit with this toe, but most of the weight or effort is done on this front leg, right? So hands out in front, like we talked about with the squat. Majority of the work is done with a single leg, but I've got the other leg to help. All right. All right. So that's our balance and proprioception. For those types of exercises, I wouldn't try and focus too much on like reps or sets or whatever. It's really about time. Can you hold and continue that movement for at least 30 seconds or up to a minute so you build up that endurance and that stability?